Hello everyone, welcome back to the Family Health Academy. My name is Dr. Ugwuanyi. I'm a licensed medical practitioner. Today we are going to discuss a vital topic on how often to have intercourse when trying to conceive. It's a very important that every partner that is embarking on a parenthood should understand this topic because it can make a very big difference as timing is very important for a productive awareness. So for you to know how often or when to have intercourse, you need to know your menstrual cycle. This is very important. If you have not watched my video on how to calculate your ovulation, same period, and fertile period, please try to watch it so that you are going to understand this better. Okay, so let's say your menstrual cycle is let's say it's 28 days. Menstrual cycle length is 28 days. So what it means is this, that the first day you started seeing your menses till the last day. That is it. Let's say you started seeing your menses on first, and another time you're going to start seeing another menses again is on 29. It means your menstrual cycle length is 28 days. That is the first day of your period, so the day before your next period is your menstrual cycle length. So we are assuming that your cycle length is 28 days. So when are you going to have intercourse? How often are you going to have intercourse to increase the chance of getting pregnant? Okay, so your ovulation, yeah? You know your ovulation. Ovulation is a menstrual cycle length minus 14 days. We assume that the menstrual cycle length here is 28 days. So you say 28 days minus 14 days should be 14 days. But because ovulation occur for a day, that is the day ovulation means releasing of an egg. It happens just a day. So we say, instead of saying 14 days, we just say day 14, meaning ovulation occur on day 14. So let's say the ovulation occur on day 14 using this our 28-day cycle. This is our ovulation date. So ovulation occur here. Sperm, after the sperm is released during ejaculation, it stays in the female reproductive tract for a maximum of 5 days. While egg, after ovulation, the egg is able to stay for 24 hours. That is a day. Fertile days are days that if you have unprotected sex, your chance of being pregnant is very high. Fertile days, it has a formula. It's to say 5 days plus the day of ovulation. The day of ovulation. So we agree that our ovulation day is 14. So 5 days before this 14 is what? 1, 2, 3, 4, 5. Then plus our day of ovulation, which is this number. So your fertile days now is from 9 to 14 days. This is the day that if you have unprotected sexual intercourse, you have a very high chance of conceiving. So, however, I want to point out something that is very important. This method work when you have a regular menstrual cycle, a regular in the sense that your period is between 21 to 35 days. That is your period can be 21, it can be 22, it can be 23, it can even be 35. So if you have a period between 21 to 35, it means that your menstrual cycle length is normal. So, but if your period is regularized, it's less than 21 days or more than 35 days, you can't use this method because ovulation is not predictable. It can come anytime. So in order to make it accurate, you combine it with the basal body temperature, your cervical mucus monitoring, and the ovulation predictor kit. This will help you to get more accurate results. So, in conclusion, how often should you have intercourse while trying to conceive? Because of the fact that sperm survive for 5 days, so it's advisable you have a sex at least 2 days interval. That is, if let's say you have on 9th, you can leave 10th and have on 11th, you have on 12th, that leave 12, have on 13th. For this 15, 14 is a must because this is day, the highest day that you are going to have the best chance because the egg is being released here. But you can have sex for 1 to 2 days. Then you can have on every other day, every day is but it's advisable because sperm can last up to 5 days. You can give a day interval, have sex here, have sex here, have sex, and then you must have on 14th. So in these channels, what we do is just teach and create awareness. If you have any medical concern, please go to hospital and see a doctor for proper evaluation and management. Please, if you are not subscribed to our channel, do so by subscribing. Hit the notification bell so that you won't miss any of our videos. Comment, share, like so that other people can benefit from this. It's a very, very important information. A lot of people are looking for information like this. Thank you very much. See you in my next video.